You're listening to a production of JM Pro Media. I'm News Team correspondent Andrew Rainey, here to bring you some information about COVID response in Haywood County, North Carolina, with health leadership of the county. After the retirement of Haywood County's Public Health Director Patrick Johnson last fall, Garron Bradish, who heads the county's Environmental Health Department, has taken up the title of Interim Health Director as well. Mr. Bradish, you're carrying quite a load with these two leadership roles amidst a pandemic. We're grateful to have you with us amidst everything to give us an update on the resources and response process in Haywood County.
Well, thank you, and thank you for reaching out to me. Well, I'll say that everything with COVID is constantly evolving and changing. When I came in the 1st of November, we were primarily focused on contact tracing, trying to reach out after we did our case investigations of positives and find out who their close contacts were, whether it be family members or in the workplace, and then try to identify clusters, kind of managing this whole caseload that involved the community and trying to limit and put out educational resources to try to keep the spread down. But now that the vaccines have rolled out, we've shifted the majority of our work now into just trying to push out vaccination to the public.
Could you help paint a picture of where the county sits at the moment with COVID? How many cases and what kind of community response you're seeing?
Well, I can tell you that when I came on the 1st of November, we were sitting at about 740 cases during the months leading up to that point. As of yesterday evening, let's see, our cases it had jumped up over 3,150. So just in the time from November 1st up until now, January, we've had a significant amount of increases in cases in Haywood County. A lot of that is associated with get-togethers during the holidays, Thanksgiving, and at Christmas. But there was also, as we saw going through, a lot of travel-related cases, people going on vacations and come back positive, and just other types of get-togethers, whether it be people getting together to watch sports at the house on the weekends or things of that nature. But it's kind of all over the place. We didn't see a lot of spread within actual restaurants, things of that nature. And to be honest, there's not been a whole lot of spread within the schools amongst students. We've had a good bit of faculty that have come in that have been positive in the schools, but not so much with actual spread within the schools between students. So we've had pretty good compliance working with our community partners, trying to eliminate any spread in those terms. Now we are starting to see an uptick in spread in the workplace, in different types of settings, and whether it be in factory settings or others where people let their guard down. They say during these interviews that they wear masks, but then they go to lunch in a break room or something like that with someone, or others, they take their masks off, and that's where you see the spread occur. You just have this momentary drop of guard, and that's what happens.
Would you be able to reiterate some of those standards that are desired for limiting and curbing the rise of COVID? Well,
we have found that the most important thing, obviously, is wearing a mask. I know that gets said so much, everyone hears it all the time, but even recently, as of this week, I've looked at some case investigations where we've had people who worked together, traveled in a vehicle throughout the day, had multiple places they had to go and work, kept the mask on the whole time. Turns out one person ends up positive, was in the vehicle with two others, was around them for maybe 6 hours during the day. The other two come back negative. And that's very close quarters, because the CDC has always told us 15 cumulative minutes in a 24-hour period of not being closer than within 6 feet of each other. Well, we see cases where people have to work in close quarters, and truly it seems that wearing a mask has prevented the spread. I know here at our agency, at the Health and Human Services Agency in Haywood County, we have well over 200 employees in this building. And yes, we've had people who've become infected with COVID outside of work and have come into the building, not knowing that their symptoms haven't really started yet, but were capable of passing COVID-19 off to others. And we've had zero spread because we've been pretty on top of making sure that everyone keeps a mask on here in this building throughout the day. So when we see other places and we talk to, whether it be government agencies or local municipalities or even large-scale workplaces, and we do these investigations, we ask, and they say, well, early on during the pandemic, we wore a mask and did this, but now we're not quite knowing, everyone's not wearing it as often as we did in the beginning, and we see that we'll have 4 or 5 people who then become infected, and that has some dire consequences on businesses. If you've got managers of businesses who think, well, this thing isn't really real and aren't really telling their staff that you really got to wear a mask, it can have a real effect when the bulk of your staff becomes positive and they're out of work for 2 weeks. So that's why I say not doing it can have consequences that you really don't want to have to deal with.
So in the situation that a resident of Haywood County does become ill with COVID, I'm curious what kinds of resources are available for individuals or families facing the brunt of the virus at the moment.
Well, what we provide, of course, is with our case investigation, we give guidance on how to socially distance within the house, how to keep the spread from occurring between spouses or between children. And we've had some luck in that. We've had people that I know well that have maybe had a child who became infected, and we've given them the guidance of how to care for that child, and both parents have remained negative throughout the entire process. So that's the biggest thing is we do provide this guidance. Early on during the pandemic, we were trying to do extra things like some resources for food distribution, taking food out to people. As the cases became overwhelming, obviously that wasn't something we could sustain. So we've relied more on sort of food pantry people out in the community, volunteers to kind of do some of that. But otherwise, we've always provided additional help for long-term care facilities, or nursing homes and things like that. We've offered PPE, personal protection, and delivered that to them, to staff and to residents to try to help make sure that they're masked and wear all the protection they have to keep the spread down. That's been funded primarily through funds with the state and the federal government by delivering to us, and then we send it out either through our emergency management services to long-term care facilities to try to help them out.
Included in some of that grant money or federal or state money, does that cover COVID tests for residents also?
Yes. We've had different agreement addendums that we've worked through for doing testing. And here at Health and Human Services, we would mainly do testing during the day when we would get word of a positive case and we did our case investigation. We would determine their close contacts. And once we determined who those close contacts were, we would bring them in through the back of our building outside and test them. As that evolved, we were kind of looking, too, with businesses to identify clusters in the area. And we would actually go out and do press releases that if we did determine a cluster, just to let the public know that this particular place now meets the definition of a cluster and basically is sort of giving that to the public so they would be able to take precautions. We've not had a lot of issues with clusters in Haywood County. We've had a few, and we've even had a couple of unfortunate deaths associated with clusters. But for the most part, that's not been a real issue. Now, with testing, we're still doing some testing here, but as our focus has shifted into trying to provide vaccine, we are not doing nearly as much testing as we did early on. We still test to try to identify clusters in workplaces and in the community, but mostly some of our testing, we've especially with our county staff, which is one of the largest workforces here in Haywood County, we now do that through our employment wellness clinics to try to determine if anyone that falls under county insurance, whether it's an employee, a spouse, a child, we still do testing there. We rely more on emergency urgent care, the different types of urgent care, different hospitals, things like that to do some of the testing. They've got that capacity a little bit better than what we can, as we're trying to be really just us and the hospital at this point provide the vaccine to the community.
When tests are available, are they free for the public?
There can be a billing on insurance if you have it, but for those that did not have insurance, we were able to cover the cost under one of our agreement addendums with the state.
You mentioned there being guidance that's offered by the county when a case does come back positive. Is that information on the websites, or is this something that case managers or caseworkers would reach out to positive cases directly?
Yeah, our case investigators would reach out to those positives directly. The only thing we provide on the website is kind of a dashboard that updates the number of cases we have, those that are in isolation, and the number of deaths that have occurred. So we do offer some of that data throughout the week. I try to keep it updated. It really kind of models what the state has too. The state keeps a running dashboard, and most counties are using that state dashboard at this point. And that's kind of where we fall in line too. We were trying to provide some extra information, especially when it came to those that we would contact up there that were uncooperative or basically never answered our phone calls. But as that's moved on, we've just relied more on the state to manage the dashboard because their numbers, the thing that occurs a lot of the times with us is the numbers kind of go through the state and then it filters back to us, and we're trying to compare them to, as our positive cases come in, those results come in and see how accurate it is. Well, we were always somewhat behind in what we were revealing to the public by the time we determined it. So we now still by what the state has because it's a little bit more up to date the way the process occurs, us finding out about our positives.
In those scenarios where caseworkers are reaching out, is there interpretation potentially available for folks?
Well, we have interpreters here that we can use for case investigation, and our website, the county's website, has the ability when you go on to it, to where you can click into it and have it in actual Spanish and be able to go through the website in that way. So if you're trying to find out information, whether it be about COVID-19 or about how to register for a vaccine, all that is, you can do that through the website by going on and clicking and having it translated over into Spanish.
I understand that food distribution and delivery is something that isn't quite as high of a priority at the moment as vaccinations are around. I'm curious, though, do you see particular groups active at the moment that individuals listening who may be looking for more resources could look to?
The only thing we've ever really worked with is our Meals on Wheels program. I do know there are some volunteer groups out there that are doing some food delivery. I know there's even some places that I've seen lock boxes where food is provided through pantries off the side of the road. We have one not too far from our building that I've noticed, but I'm not sure exactly who all is doing food delivery out there as far as those volunteer food pantry staff and who to contact, but I do know that is occurring.
It's really a relief that vaccinations have begun to come into our various communities. Now that that's begun, can you describe the timeline and facilities that are opening and processing for folks in Haywood County?
Absolutely. We've to date basically been working to vaccinate with our allotment of Moderna. Our shipments come in at different intervals. We've had weeks where we've had as much as 900 doses come in. We've had 500 doses come in weeks. We've had 100 doses come in a week. But for the most part, we've kept a pretty high number here, what we've been able to do. We've also worked with Haywood Regional Medical Hospital and recently had a transfer of their Pfizer vaccine to us where they transferred 1,675 doses. And we were able to hold some drive-through clinics at the Haywood County Fairgrounds and administer those. We started off a little small, trying to get our bearings on how we were going to do vaccination clinics, and had a lot of by-appointment walk-in clinics. And now we've scaled it up to doing some of these large drive-through events on a weekly basis. All of it is always dependent on vaccine. But even yesterday, we had a drive-through clinic where we vaccinated 1,440 people with a target age of those 75 and older. So we've got the criteria from the state of the phases. And early on, we worked with some volunteers and some other staff with the county and developed a hotline number where people could call in on the hotline and do a pre-registration to get the vaccine. Then we also developed through our websites where you could go onto a link at haywoodcountync.gov and just register yourself through the website. From that, we have built this database that is quickly approaching 15,000 people that have registered. We've vaccinated mostly that older population that has been hit hardest by COVID-19. We've been working through that 75 and older. To this point, we've vaccinated well over 4,000 people, really approaching 5,000 people. And we are planning on doing another clinic this week, before the end of the week, which will exhaust the remaining supply of what we have for first doses. After that, we're waiting to see next week what North Carolina allocates to us going forward. We do know that the federal allotment of vaccine for North Carolina over the next month is going to be a little less than it has been. I've heard numbers of a weekly amount of about 86,000 doses that will be administered to all the counties of North Carolina. So when you look at 100 counties, that's only 860 doses per county. However, the other factor of that is it's going to be based on population size. So those counties with a larger population will receive more doses of vaccine on a weekly basis, and more rural counties will be limited to smaller amounts.
Looking at the Haywood County NC.gov page, I see the COVID-19 helpline listed as 828-356-2019, open Monday to Friday, 8 to 5. So would this be the number that individuals could call in order to get registered for the vaccine?
That's it. If you call there, we have a staff that mans that Monday through Friday, 8 to 5, like you said. There's about 5 people on a rotating staff there manning those lines. So if you'll call in, they'll go through a short questionnaire with you, get your information, and then they will. You'll be contacted of when your particular age group or your demographic comes available, and you'll be notified by a system called Everbridge, which is a system that is commonly used by emergency management services, and it sends out a text, 3 phone calls, and an email. So the more information you can provide, the better it is that we can get a hold of you.
So for folks calling, is there interpretation possible there? And if not, would y'all be interested in receiving interpretation?
That's something we have talked about, that we would like to possibly try to get some interpretation through the hotline. For the most part, we've got a system that is in place where you can call and has multiple languages. That's one of those automated systems that will translate through the phone. And then, like I said, we've got the website where we can you can go in and switch it over at least into Spanish and register that way.
So individuals at this point who speak Spanish predominantly may be better to schedule a vaccine appointment online where it can be switched to Spanish, or by calling the main health services line?
If you call the main services line, we still do have interpreters here at Health and Human Services that they can transfer you to, but we're kind of limited with just 2 interpreters who are also involved in court cases and everything else that involves this entire agency. So it's not as easy to get the interpreter on the phone at times because they're very busy since there's only 2, but we do have that ability.
That phone number is 828-452-6675, listed on the website. It sounds like the website is probably the easiest way at this point, although there's a desire to get more interpreters.
Yeah, and we are looking at different options. I know our public information officer is trying to look at different options, being able to reach out to different communities to get people registered for vaccine. And we've actually got some people who I know that are trying to work through, like vecinos and some others that are trying to promote vaccination to different groups. I think there's even a testing event going on this Sunday through one of those groups, through vecinos here in Plainsville. So we are trying to do some reach out and trying to contact some of these communities.
So at this point, I've heard the preference is to target folks 75 and older for a priority vaccination.
We're still trying to vaccinate that 75 and older crowd. We thought that we could possibly move into the 65 to 74 age group this week, but we've had another large amount register. The demographics of Haywood County would point to us having around 6,000 people in that 75 and older group. And we've quickly approached about that number. So I'm trying to determine today if people have registered multiple times and if that's what the issue is, or if we've got people from all other counties who are trying to register in Haywood County to get the vaccine. So we're trying to determine what it's going to take for us to move into the next phase of getting into the 65 to 74-year-old group.
In addition to that group, are frontline workers also included in that priority vaccination at the moment?
We have vaccinated law enforcement and firefighters. We've vaccinated a lot of our doctor's offices, dental offices, different types of health care and nurses, staff. So we've already worked through the majority of that group. We've got some that have reached back out to us that say maybe physical therapists or different types of other who may have gotten a little bit left behind, and we're trying to work them in as we go forward. So that's been our primary focus on kind of those frontline workers that deal with health care that we've vaccinated.
Can those essential workers enroll independently, or do they need to be registered with the county through the workplace? If they're associated with a larger business or something like that, we kind of are asking them to provide a list of employees that are essential workers, their names, their phone numbers, so that we can track them a little bit better. The one problem that gets associated is if all these individuals register through our hotline, sometimes the numbers get so large in the database they can get lost in the mix, and we don't realize they may be essential frontline workers. So recently I've had some people who go out into homes to do different physical therapy type things and associated with businesses. And we've asked them to all get employees all together and give us basically a list of their names so that we can track a little bit better who these essential workers are and be able to keep up with them, so that maybe we hold a larger vaccination event that just hits some of these essential workers. Is there a documentation, whether driver's license, social security card, passport, visa, or medical insurance required to register for a vaccine?
There's not. We do have there's some questions that if you call in or you go onto the website that you do have to answer. We are looking at some proof of residency at this point, but usually that can just be a driver's license. Most you might be asked to provide, just because we're becoming even a little bit more limited on vaccine, and we're trying to hit these target groups. And early on, we had some drive-through clinics that were geared, let's say, just to the 75 and older, and we felt that there were some who were trying to come in who really didn't meet the demographic, trying to sort of sneak in, I guess you could say. And when you're trying to work through one group after another, you really want to hit that target group so that you can move on to the next. And so now we do ask at times for driver's license or something to show residency, but other than that, we really don't require much information to get vaccine.
I see. So some marking of residency, perhaps a driver's license.
Yes.
Is there a cost to the vaccine?
No. The vaccine, originally, when it was put out by the federal government, it was as a free vaccine, and we had the option of looking at trying to charge an administration fee to insurance, but we decided no, that this vaccine needs to be free for all people to try to fight COVID-19.
For listeners who might have follow-up questions or just looking for resources that maybe are already out there, where would you recommend folks to look or to bring further questions?
Well, we do have the hotline that is open, and they do take questions just about anything with COVID-19. And if they can't answer your question, then we pull lists and it gets sent on to us, and we try to answer and get back to people who have more specific questions. Also, there's the ability to, they can transfer you to the state's hotline where they can answer different questions about COVID-19, ranging from effects to isolation times to just about anything you could think of that comes up regarding COVID-19.
Just to reiterate that number, the Haywood County COVID-19 helpline is 828-356-2019. And then the standard number, which does at times have two interpreters present, is 828-452-6675. As you mentioned, there's the haywooddnc.gov website, which also has lots of resources and Spanish language material. I want to give you my deep thanks, balancing two roles amidst a pandemic. Really grateful for you spending this time with us today, Mr. Garron Bradish, the interim public health director of Haywood County. Thank you so much.
Well, thank you, and thank you for reaching out to me. I hope the public can use some of this information to hopefully keep themselves safe, and we'll look forward to vaccinating everyone we can get to in time as we move through these phases. And as much we try to get this vaccine out as quickly as we can, as soon as we get it.